and then we're just gonna chat about your part 2 exam as a merit winner of 2 exams.
You're gonna really talk it up, are you?
Hi everyone. Now for this series where I'm going to be interviewing people who are really in the space of doing this exam well, examiners, previous trainees who've passed the exam, I've now got with me Dr. Ian Chow. So Ian Chow, he got a merit for the final exam. He really knows how to study. He's done quite a few exams. And I thought Ian, thanks so much for coming on board, because I thought you'd be a really great person to just get lots of tips. So yeah, I thought we'd go through your approach, what you thought about this exam, your approach to studying, your approach to memorizing things and the vast amount of content, whether in the SAQ and the Viva, also yes, your delivery techniques and exam structures for the SAQ and the Viva, and whatever else that comes up. But I thought we'd go for about half an hour talking about that. So welcome.
Yeah, sure. Yeah, a pleasure to be here, Lahiri. Thanks for the invite.
So let's get started then, Ian. When how did you first approach this final exam for, the final ANZCA exam?
Yeah, right. So first of all, there are no secrets to the Part 2 ANZCA exam. It has, even though it's changed somewhat over the years in terms of the structure, the approach has been always the same. You need to put your hard work into it, and you need to plan your time. And I think that without direction, it's very easy to sort of just coast along and then all of a sudden get bamboozled with how much there needs to be, you need to cover. So I think having an idea of how to approach it is very, very helpful. I do believe that you need at least a good year in advance to approach it. So, it doesn't mean that you're going at 100% during that time. It's a marathon, right? You've got to learn to pace yourself and to peak at the right time. And I think that they're really the keys and the tips that I was given prior to embarking on studying for this. It's one exam where it's very mentally taxing and emotionally taxing, not only on yourself, but on your family and friends around you. So it's something you only want to do once. And so you commit to that year so that you give yourself every best chance of passing it once and once only.
What was the conversation that you had with your family, your friends? What did you tell them?
That's a good question. I've thankfully got a very understanding wife who helped me get through my first part ED exam and then my first part primary exam. So she kind of knew and basically gave me an ultimatum. You're only sitting this once as well. So, obviously having a very supportive partner, to also that they understand what will be involved, the commitment in terms of the need to study and organize your life around study groups and whatnot is very important.
Yeah, I remember having that conversation where I was like, look, I'll have only this amount of time. I think I still had Friday and Saturday night. That was sacred, always, time that I'll just have to myself. Yep. And then that said, if you study a good 4 hours in the day, that's really, there's as many good hours as I've got.
And I think that if you have enough time, you approached it, a year off, you're going, wow, it's there in the distance, but I'm still going to have a good work-life balance. I'm still going to take time off for myself. And exactly as you said, whether you devote, your Friday, Saturday night is going to be no study time. I think downtime is very, very important. And if you approach it with that sort of planning in mind, then you shouldn't be overwhelmed that you don't have enough time to cover everything.
When people say 1,000 hours, do you agree with that? And how did you break that 1,000 hours down?
Geez, in terms of quantifying, in terms of hours, I don't think so, because everybody's got effective study time and non-effective study time. We all know where we say we're going to commit to doing 2 hours this Saturday, and this Saturday comes along and you're kind of exhausted after a long night shift or whatever, and then you sit down and things aren't really sinking in. So I don't know if I can quantify that 1,000-hour time limit.
I hear the 1,000 hours a lot, And
Yeah,
I
right.
personally probably agree with it. 2
What,
hours.
what I probably agree with is you do need to put in the time and effort. Even if I know a lot of watching this are coming from a overseas medical background. Is that correct, Larry?
No, this will be for all
This could be
trainees.
for everyone. Yeah. So I think that um, what I would say is you have to put in the time, regardless of what your knowledge is before. You need your time to be able to go through the amount of information that they're expected us to know.
Yeah.
So look, I'd probably would tend to agree with that.
Yeah.
That 52. Yeah.
50 was it 50 weeks, 20 hours a week?
Yeah. Yeah. Which would be about right if you sat down and studied well, gee, that's quite a lot.
a couple of hours a day on weekday or on the.
I think that, yeah, as I talked about a marathon, obviously that is pretty much expected near the pointy end of the study period. You're probably not going to be doing that at the start. And I guess, when we talk about planning, it's knowing that you're really going to be in that hunter-gatherer stage in the earlier parts, and you're sort of trying to wrap your head around what goals, what mini goals you're going to have leading up. And then, definitely by the time you're getting towards the 3-month mark, I think, 20 hours a week is what I would expect you'd want to be achieving.
So how about that? That's a good transition. When you looked at this journey ahead of you and this training for this marathon, how did you break up your study for your MCQs and SAQs? Do you remember what your strategy was?
Yeah, I think my strategy, whether it works well for the new exam or not, was essentially try to do as much as possible, and just to repeat, and just practice. So as many, they used to tell us, if you do 5 years of SAQs, you'll be fine. You probably will encompass a good proportion of the syllabus, and they're saying more than 5 years, it starts getting outdated. You don't need to cover it. I didn't really believe that. I think Lahiru, you and I studied together, and we went back 10 years, didn't we?
Oh, we did.
In terms of SAQs, and I definitely did not find a negative of doing more exams rather than less.
I totally agree with that. As in, I remember just the breadth of how much there is in the syllabus. You might as well have practiced it.
Correct.
Some real exams. Why not? And I remember even the MCQs. I went back 12 years.
Yeah,
I did
that's right.
years.
Yeah, that's right. We found some old ones, and people go, "Oh no, don't worry about that." And you'll come across questions that they'll ask about enflurane, and you'll just
there was
don't worry about that. But you'll still come across those questions that you go, "Oh my gosh, I can't believe that was actually a repeated question last year, even though it was from 12 years ago. They must have dug it up." And it's still, most of the science doesn't change. Most of the information doesn't change. My approach was to go back as far as possible and try to do as many as possible. And that was my goal at the early point, was to get through that amount of work first, rather than stolting on page 1, reading that through. I think the SAQs and MCQs give you a good direction of what you need to study. And the first time you sort of approach them and write your own answer and whatnot, you kind of feel a bit like, how much depth and how much breadth do I go into? And the more you do it, then you start understanding it, and then maybe you'll come back and revise your own answer.
Yeah, which I like. There's a very exam-focused method. You've got the MCQs there, you've got the SAQs.
Yeah.
Don't worry too much about other things that are going on. As things come up in life in the 12 months, you tackle it, you learn it, and you hopefully learn to a little bit more than what your consultant conversations are, because they'll know the practical stuff of it, but they won't know necessarily the depths and the numbers and the figures.
Absolutely. And you can't just rely on just doing, Vivas is a different matter. I think Vivas is very much that, but for the written, you absolutely, one of the important things I learned was, don't reinvent the book, right? You don't need to reinvent it. This exam, as I said, has been the same thing for the last whatever years. And you've got a whole range of consultants who have gone through this and therefore have written very good in-depth answers to SAQs. So rather than you write up yourself, get your collection, start hunter-gatherer, get previous people that have written their exam answers, and not necessarily study off that, but use that as the basis of forming your own answer.
I think that's exactly what I did. And when I found those notes, I think particularly a good set of notes from Louise Allard.
Yeah, that's right.
I think everyone used these notes. It was like a really amazing, well-written textbook, better than the Oxford.
Absolutely. I mean, somebody's already taken the pertinent information from each of the relevant textbooks or studies related to that topic and already dissected it down to their perfect answer. And what I say is rephrase that or restructure it to your own flair, so then you can memorize that for yourself.
Okay, now there's a lot of talk about MCQs and SAQs and studying, and some people say, look, don't worry about doing the SAQs. And I've got my very strong opinions on that, which I've put on the website. What do you think about that?
So people are saying, oh, look, you should save the SAQs till you've learned everything and then use them to practice. So you know your knowledge. I don't agree with that at all. Maybe save 1 year as your practice ones, but what we do at Eastern Health is we will tend to come up, so we'll kind of create our own exam based on questions that a group of us have written ourselves, and that can be your practice exam going in. There's not going to be a brand new topic, it's just going to be a different spin on the same topic. So the neurosurgical question is always going to be roughly the same. The difficult obstetric pre-eclamptic questions always going to be the same. It's just going to have a different spin on it. So having that base information already from previous SAQs, you can always tweak it to answer a new version of the question in the same adequate way. I didn't find that there was a problem doing all the SAQs first and using that as my basis to be able to approach SAQ questions.
And I needed that to just practice my handwriting and structuring things and just that all those non-knowledge skills about answering, like you wouldn't.
I think that's what you talk about when you said exam focused learning, right? You're knowing what your goal is. Your goal isn't to know how to, might sound funny. Your goal for the written, at least, is not to learn how to give a neuro anesthetic. Your goal is to be able to show the examiner what you know about neuro anesthesia in a 10-minute block.
Yep. And actually, that's right, because often the Vivas aren't repeated necessarily either, but everyone practices Vivas because it's a skill, talking to someone, formulating plans.
Absolutely. I mean, you might get lucky and then you might practice an SAQ that comes word for word on the day, but generally not. It's generally not going to be. It's not going to be exactly the same question that it was. At least you're not going to get all 15 are going to be exactly the same. But by doing the vast amount of SAQs beforehand, you should be in a position where no matter how they spin a pediatric question, you're going to know roughly a framework on how to answer it.
Okay. How did you make the most out of your work time? Let's say, you're working long 10-hour days and lots of
absolutely.
How'd you make the most of it?
Yeah, good question. So this is what I tell my registrars. So if we, for instance, are doing a AAA in a couple of times, and I'm hoping my registrar will come up to me and say, hey, we're doing a AAA in 2 days. Can I go through it with you? And I say, yeah, fantastic. We come up with our plan. And then, so there we go. We on the day, you're actually taking before that. Hopefully you've done a bit of pre-reading beforehand, knowing that, okay, I'm a 4th year heading into exams and I've got the opportunity to do a suprarenal AAA this Thursday. Well, hopefully you're going to pre-read around the topic as you would normally do, right? It's not even exam focused. Hopefully all registrars are doing this before major cases. And then on the day, hopefully already having a good understanding of the anesthesia, then able to use that as a discussion point with your consultant during the case and throughout the case. But also more importantly, revise it at the end, like, in the next 48 hours as well. Go back and write down all the key points that you've learned. I think I was told this bit of information. I actually learned this on the Australian Resuscitation Council's Train the Trainer course. Can't remember what it's called, but basically for the ARC, if you want to be an instructor. So what they taught you was how memory works. And they talk about it as having, you've obviously got your short-term memory, and how do you convert that short-term memory to long-term memory? And it's about repeating that information several times to convert your short-term memory into long-term memory. So take the instance of doing a AAA. So you've discussed it, you know about it, you think you've learned it in that first sort of 48 hours around when you've done AAA. Then hopefully you go home and you write down everything you know, or you read all your previous SAQs regarding AAA. And that'll keep in your short-term memory for about 2 weeks. Now, if you don't go over that within that 2 to 4 week period afterwards, it starts deteriorating. You start losing it from your short-term memory. But what you want to do is you want to move it into your long-term memory space. And the only way to do that is to review it again. And if you review it at that sort of 2 to 4 week mark, you tend to push that information into your long-term memory. And hopefully you can sort of like say at the month after you've done that case with your consultant, you can say, tick, I've done AAAs. I think I know everything I need to know about that. And I can park that aside. I might need to come back at in a couple of months, but you can give that a big sort of tick of that I've completed that knowledge base around that case. So not only you just turn up to work and you do the case and that's it, but I'd suggest in sort of at least the 48 hours afterwards, you review it, you write down on your paper everything that you think you need to know about an SAQ related to that topic, and then in 2 to 4 weeks time, go back and just revise over your notes. I think that's a good way to use your time at work as well.
Yeah, that sounds good. And even like, I know that a lot of consultants many years after the exam won't be so sharp with certain things. Being able to send them the article, send them the notes saying, hey, like you said, prep them to the fact that we're going to be chatting about this topic, so they'll be ready with their stuff as well. And I think that makes them feel good that they can help you out and feel useful.
You're being a little bit proactive in your learning as well that way, rather than just sitting back and taking a back seat to your learning. We're there ultimately as consultants to treat our patient in front of us to a point where we want to educate as much as possible. But when you're changing the focus and saying, oh, look, I really, really want to knock this off in my knowledge, would you be able to help me to attain that when we do this case on Thursday? Then it changes the focus of the consultant as well to say, oh, okay, yeah, of course. And most of us are wanting and willing to learn, but yeah, we might need that little reminder about things to remember to discuss all the facets of that detail relevant for the exam.
Yep. Now that probably segues really well, because I think we already mentioned a few things. We mentioned the forgetting curve, I guess the Ebbinghaus forgetting curve, mentioned spaced repetition, and just a lot of hard work, so essentially immersive learning. So repetition or spaced learning, the forgetting curve and how to hack that. Do you have any other general principles for helping memory? Because I just remember you were really good at just recalling facts. You had a pretty strong memory from what I remember. And
I probably should say short-term, intermediate term, and long-term. Probably I used my short and intermediate for the exam, and now long-term, I might not remember the details. Everybody finds their way. To have reached this point, hopefully you have an understanding on what works best for you in terms of knowing how to learn things, whether people sit down with notes and highlight. I never found that useful, but some people do. I think the most useful thing to do is in the early months, at least, you should just be, learning, actively learning. So you're writing SAQs and you're committing to memory. The best way that I found to remember those tidbits of information is you got to practice. You sit with your SAQ, you go, okay, I'm going to do this. I'm going to try this SAQ that I wrote an answer for a month ago. Turn her over so you're not looking at it, and then write down as much as you possibly can. And then you probably won't have everything that you've written on the page. Then flip over your cheat sheet, look through and said, I forgot this point, and fill that in. And you might have to do that 2 to 3 times, depending on what topic. Some topics you'll commit to memory a lot easier. Some topics will be, dry things like sterilization and those type of things you might have to do several times. But I found not just reading, but once you've got the information there, to just write down as much as you know about a topic, and then check your notes and immediately find out what you've missed. That was my approach. I've lost audio, Lahiri.
There we go. It's from my coughing fit before. I think that's a good summary. Essentially, immersion, repetition, spaced learning, and then all that proactive stuff to make sure that you're constantly doing something, and active learning. So you're writing things out. You're actually, what is it? If you're just reading it and just listening to it, as much as people are going to be listening to this as a podcast or a video, that's just the start of it. Do it while you're driving.
And when I say a year, I think it's the same, right? I'm not expecting people to be sitting down doing practice SAQs and MCQs on their first week. I think that first 6 to 7, maybe 8 months, really you're just getting in the zone, right? You're getting good habits, like you're meeting up with the study group to discuss topics. You're knowing how to frame a 10-minute question. I think that's a very important key as well, to remember that these are 10-minute. There's only so much information you can put down in 10 minutes, and knowing how to not put everything. I'm not too sure whether anybody's going to speak about how they go about marking SAQs, and maybe you'll be able to get this from the mouth of an examiner. But it's very easy. Well, it's very achievable to easily get a 5 out of 10 by not writing too much information down. In fact, you could probably achieve a 5 out of 10 in the space of maybe 5-6 minutes of writing.
Yeah.
And then it's getting that extra to 7 to 8 out of 10 marks in that last few minutes of your SAQ, is just writing those extra facts. But I think a good way to approach it is you're aiming for a 6 to 7 out of 10 for most SAQs. Don't aim for a 10 out of 10. Don't expect you'll ever get a 10 out of 10 for an SAQ. So you don't need to put every minutiae of details into your SAQs. You should be able to have a perspective of what the important information is to get a reasonably good passing mark.
Yeah. And so then that's good. So we've talked about general structure and hours of how you approach the year of study and all that stuff. Your approach to doing overall study with MCQs, SAQs. How about the actual delivery of the SAQ? So we've gone through that in a little bit of detail now. So stick to your 10 minutes. Don't go beyond that. Just go for a reasonable marks out of 10, 7 out of 10, or a pass mark. Any other things with structuring your writing for this? Oh, by the way, one thing, I do believe starting writing SAQs from the very start is useful. I did that straight away for the final exam, which was far easier than the primary exam when I delayed it for a very long time. The hesitancy of putting, being judged and actually writing an answer is a lot. But get into the flow, learn your structures, all that, and then start making mistakes and progress, not perfection, with the SAQs.
You've got to start somewhere, and nobody judges you on how well or not well you write an SAQ, no matter where you are. Even if you're 2 weeks out for the exam and you write a horrible answer for a practice SAQ, no one's going to judge you for doing bad on a practice 5 or a practice exam, whatever. The only person who's going to judge yourself is yourself. We don't think about it. It's not like you end up coming back, like a registrar comes up as a consultant, you go, oh my gosh, they were terrible in their practice 5er. Nobody cares. The biggest mistake you can do is not put yourself into that situation, right? There's nothing lost from failing a practice exam. There's everything lost by failing the actual exam. So put yourself into situations that will make you uncomfortable. Put yourself where you're going to practice doing a question and it asks you some very unusual topic that you were not ready for, and all of a sudden you have a mind blank. Well, that might happen in the exam. So give it a go, see whether you can go, okay, this is a question that I'm not going to get 10 out of 10. I might not even get 7 out of 10, but I'm going to try to get 5 out of 10, and therefore that's still a pass. So you force yourself in that situation to write as much as you can. And how are you going to deal with that mental block if it happens in the exam as well? I had a question where I sat there staring at the SAQ for a good minute going, I think the question was, define acute renal failure.
Oh, I remember that. I was about to say.
Remember that? And then I sat there for like a minute just going, why am I having a mind block? It was like a 2-section one.
Yeah.
So having been in that situation before, I just put it aside, moved on, stuck to my game plan, answered question B, and then came back and answered question A, exactly like I was planning to do. And I passed, so I must have done okay.
Hey,
but if
you
you
got a prize.
Yourself, yeah, but if you kept on saying, you know, you keep on making excuses, right? We're all very good at it. Oh, look, today's not a good day. Oh, you know, I don't feel great today, whatever. And you don't practice what you're going to do. If you come across a question you don't know how to frame, you're going to run problems in exam.
Absolutely.
So like Lahiri say, well, he started very early. I probably didn't start writing MCQs, at least not timed, until the last probably two and a bit months before, I reckon.
SAQs, did you say?
SAQs.
Yep. So yeah, I mean, that's a good comparison. So I started in March, April, and just hit the ground running.
My approach with SAQ was to write a perfect topic, perfect 10-minute answer, and then collate all those topics together. And then 2 months out, I would go back and grab a question and try to write a 10-minute answer. Definitely 1 month out, you should be doing timed answers. Absolutely. And not only that, but even I suggest to my registrars at the 4-week mark, you actually start doing proper full exams. So I remember Lahiro and I would call each other up and say, okay, we're going to do this, right? And then we sat there. I can't remember if we did it together or
we did it as a group once.
We're just going to say, hey, we're going to do this, right? And we sat down and forced ourselves to do a full exams. And I remember we did this in like January, you know, like the first 2 weeks of January or whatever. Because you don't want to be doing that a week or two before the exam because you're going to cramp up. You want to save your strength in your hand because, but you also want to build up to that. So I reckon that sort of ideal time to be doing 15 questions under exam conditions, force yourself to sit down and do it, was that sort of that 4-week mark.
Yeah, good. Because I remember I did it probably have 2 full exams over the time. I wish I did more, but it's hard to find the time. And just to get the endurance. So we used to...
Yeah, the endurance is the big thing. Yeah.
We used to switch between, you know, 1 question at a time, 5 questions at a time, 3 questions, just to vary it up. And slowly, it's almost like sprint training. You slowly build up the sprints and do some...
Yeah, like that marathon we were talking about, right? Yeah. So it's like, you don't want to be doing full 15 questions the week of the exam. The week of the exam, you just need to just chill, and then you just sort of building the confidence before the exam.
That's right. Hey, so that's the SAQs. And moving on to the Viva, any specific kind of things that you would recommend?
Approaches? I think everybody says the same thing. I was given this advice and I didn't believe it, but I did it because you do not need to worry about the Viva until you've sat your written.
Yep.
Would you agree with that, Lahiri?
Yeah, I think
that there's more than enough time in that interim to go full Viva mode study and be ready for it.
And just a little clarifier, when you study for the SAQ, that's learning your knowledge and structures and categories that you will use in the Viva. And it's not a bad thing to verbalize it like a short answer, but you can leave that for after the written.
Yeah. I think that you expect that your knowledge base is pretty decent by the time you've sat your written, probably at the peak. And, you know, you will come across a little bit more information to cram into your brain before the Viva. But the Viva is the game of presentation and being able to verbalize your plan, your anesthetic plan and knowledge to your peer. And I think that that's one of the big tips that I have is just consider the Viva is a colleague-to-colleague discussion about a potentially difficult patient that you may be anesthetizing. And then it takes away the bit of the fear. So if you have the confidence to know that you believe that, there goes Lahiri, cough, cough. I think that, yeah, if you believe that you are worthy to pass the exam, you've done the hard work, you've done the training, and you're going to be a consultant anaesthetist just like your other bosses, then all it is the Viva is just, hey, your colleague has a question about a scenario and he's asking for your advice. And that changes the mindset rather than being that you're a registrar telling a consultant what you think you might do. You're now thinking yourself as, I'm a consultant telling a fellow consultant how I would approach this anesthetic.
I think that's really, really useful, because if you think of the frame you're in is, you make it realistic. You're like, oh, you get a challenging problem that's pretty tricky. You go, yeah, this is tricky. I think I'd do this. And, what do you think? And obviously you can't ask, what do you think? But, you're offering these realistic statements like, oh, blood pressure goes to 70. Oh, that's probably normal. I'll give a bit of aramine. Oh, now it goes to 50. Okay, there's crisis mode. Like you're being realistic in a conversation with your mate. Look, that's I think that's good. I think we've covered probably a good 40 minutes of chat about the exam. So we've gone through just the overall preparation, MCQs, SAQ, and approach to those, and then a few formats with SAQs and Vivas. Is there any other tips before we sign off on this kind of quick fire questions?
I'll add one thing regarding the Viva. And it's the confidence that you bring into the Viva. Not to say that you answer the questions being cocky. I mean, with confidence. You may have never ever treated a obstetric patient in a trauma situation, but at least act as if it doesn't stump you. Like you go, that's a tricky situation. Obviously these are the concerning features. But if you sort of approach it as saying that, look, I don't have the answer, but my approach would be A, doing this, knowing that these are potential issues with my plan A, and failing that, then I'd also have my plan B. That's how I'm going to approach things. So at least if you present it that way to the examiner, they go, okay, he knows that doing a rapid sequence induction has its risks because of A, B, and C, but he's decided to do that because he's balanced the risks and feels that that's the safest way. But at least he's aware of what the concerns are. I think that the biggest issue for examiners, I might be wrong, I'm not an examiner, so I put that as a big disclaimer, but I would say that the biggest issue is when they see a registrar who seems to be doubting their approach. And it's not that they smell fear and pounce on it, but they're going, are they really sure they know what they're doing? What we're training anaesthetists to be is somebody who can look at the potential issues and work out a balanced approach, but always have a plan B and C in their back pocket as well.
I think that's it.
Whereas if somebody comes in and said, oh, I guess I could do a gas induction, but I know that they're unfasted, so I could do a rapid sequence, but I know rapid sequence, they might have a difficult airway. And then the examiner's going, so what are you going to do? Are you going to,
like you're a consultant. At the end of the day, you have
at the end of the consultant, you need to know. And this happens at a day-to-day basis, right? Sometimes we approach a case and said, look, I don't know whether I should do a rapid sequence or a gas induce this child with a foreign body, but I'm going to choose this. And I know that this might happen. And if that happens, then I'm going to do this. And if that happens, then I'm going to do this.
I think that highlights a really important thing. This exam is about making decisions primarily. And when you get a difficult decision, it's exactly what you said. I've got to make a decision. I've got to say that no decision's perfect, but I know the problems and I'm going to get ready for the problems. And then I've got another plan in place as well. That is exactly, I think, I've had examiners tell me that's exactly what they need from us when we ask these questions. And that's what we do in real life. No decision is perfect at the pointy end of things.
Yeah, exactly. And that is the Viva. The Viva is going to give you situations where that there is no correct answer, but they want to hear that you understand the challenges of choosing said approach. And if they know that you're aware of that, then they go, oh, excellent, thank you very much. Yeah. So that would be my advice, and that's what I tell registrars sitting exam as well. is to not necessarily be cocky about the approach, but have confidence in your approach. If you have thought about all the concerns and the backup plan B and C, then you should be right.
And obviously in this online course, I've got more information in the Viva videos that we'll talk a bit in length about these decision making and difficult decision making. But I think that's a great way to end. So straight from a merit winner, Ian,
a long time ago.
That's right. It sticks. It sticks. It's there for life. It doesn't go away. And generally, thank you so much for being here and giving your advice. I think that'll really help. And hopefully,
pleasure. Look, I hope it helps somebody in any way.
I'm sure it will. Thanks for your time, Ian. See you next time.
Cheers.
Cheers.